So thank you very much for everyone that's here. And the first item on the agenda is going to be call to order, which I've done so. The next one's going to be roll call. So Miguel Mojica, myself, I'm here. David Aherons.
Here.
Randall Duncan.
Present.
Catherine Mize.
Here.
Mark Kirchner. Not here yet. Ray Smith.
Here.
Thank you very much.
Mark's not coming today.
Mark's not coming today. All right.
He's out of town.
Next on the agenda is going to be the training for advisory board members. Alex Phipps is going to be.
Alex, hold on. Mary Winston, hold on one sec. Your microphone is not on. Let's make sure we get that mic on for people watching. Okay. Mr. Fickle's coming.
You can get mine.
Technical difficulties being solved as we speak. Mr. Mojica, while
Yes,
that's
ma'am.
going on, you can go to D and then back up. Just the
Okay.
approval of minutes and then back up.
So item D, we're going to move to item D, and that'll be approval of the minutes.
Randy Duncan, motion to approve.
I second.
All in favor?
Aye.
Aye.
All against? So moved.
I think we have a functional
All
microphone
right.
now.
Go
Okay.
back to item C.
Okay,
Mr.
so
Phipps.
to say everything I already said, Alex Phipps, I'm the new Assistant General Counsel working in this program. Did leave my cards on your computer screens. If you do have any questions, feel free to shoot me an email or give me a call. I'm going to give the training. I know we already did this training in September, but we do have a new member, so we'll go through it again. I'll move quickly, but if you do have any questions, feel free to stop me. Let me know that you have a question. We'll try and answer that for you. Or after this, if you chew on it a little bit and you have a question, definitely shoot me an email or anyone else in the department. We'd be happy to help you out. So with that said, we're going to go through the training we have here. We're going to be covering 3 different acts, Texas state laws. This is the Open Meetings Act, the Administrative Procedures Act, and the Public Information Act. First one will be the Open Meetings Act. Purpose of this act is to ensure open and transparent government. It requires meetings of governmental bodies to be open to the public, preceded by public notice, and inform the public of the time, place, and subject matter of the meeting. It's a liberally construed act, and that ensures that the public is able to review everything that happens in your meetings. So, quorum is the first key concept that we have. Quorum is a majority of the advisory board. You have 7 members by statute, so 4 of you constitutes a quorum. Once you have that quorum, if you can take actions, official actions that are on behalf of the board in your public business. If you do not have a quorum, you cannot take any official action. Deliberation means a verbal or written exchange, so that could be any sort of written exchange, an email, a text, anything like that, between a quorum of the governmental body and another person, or between the quorum itself. The next concept is meetings. A meeting occurs anytime a quorum of the public body engages in deliberation regarding public business. That is anytime. It does not have to be a specific event. Anytime that you gather as a quorum, you do have an open meeting. Final concept is notice. Notice must be given in advance, the date, time, place, and subject of each meeting. We prepared an agenda for you that's published on the Secretary of State's website as well as our website. You cannot engage in any discussions that are not included in the agenda. So that's an important point, with the exception that additional items can be appointed for a future meeting, and we'll talk about that here in a minute. So there are some exceptions to this concept. For example, if you're at a continuing education course or something like that, can you talk to your fellow board members? Yes, you can do so. You can engage in conversation that's incidental to the event you're at, for example, any kind of social function. But you cannot talk about official board business. Once you begin deliberating, you are engaging in a public meeting and you would be in violation of the Open Meetings Act. Key points to remember: be aware of any situation outside of a properly noticed meeting. Anytime you are around your other board members, please be on alert. You do not want to violate the Open Meetings Act. Do not engage in any substantive conversations about business or policy about the board when there's a quorum present. And please beware of the walking quorum. Walking quorum is when fewer than a quorum of the members engage in discussions about official business. So for example, you may have different members of the board texting or sending emails to each other. You can very quickly reach a walking quorum by communicating with each other. We have an example here. For a 5-member board, 2 members are exchanging phone calls and emails about an upcoming rule change. Subsequently, you engage in conversations with another member. You've reached a quorum. You're talking about official business of the board outside the context of the open meeting. In that situation, you could be in violation of the Open Meetings Act. They can occur on conference calls, video conferences, even in the hallway, break room, walking to the restroom. And it's important to keep in mind that emails, text messages, and other technology make this much easier to do now than it was when this act was originally adopted. So please beware of engaging in any kind of electronic communication that may violate the Open Meetings Act. So for best practices, meet in small groups. Do not discuss anything about official business with the board. When you get emails, make sure you're not sending emails about business regarding anything that's on the agenda or anything that's not on the agenda for an open meeting. Make sure you do not create posts on social media where someone else in the board might engage with you and create the opportunity for a walking quorum. And don't ask a quorum of the members, even on an individual basis, about how they plan to vote or how they plan to act for any sort of open meetings violation possibilities. So guidelines for open sessions. Board or committee is limited to discussing the specific items on the agenda, as we mentioned. During public comment periods, members of the public may speak about any topic that they would like to bring up to the board. You can impose reasonable limits on them. However, a member of the public or a member of the board may raise a subject that's not on the agenda. The only discussion that can occur about that topic is putting it on a future agenda. Best practices: limit discussions to specific items contained in the agenda posted and filed with the Secretary of State. Avoid allowing discussions regarding agenda items to wander off course. Don't respond or discuss issues that are raised during public comment but which are not on the agenda. And, identify items to TDLR staff so that we can assist you putting them on a future agenda. So there are civil and criminal penalties for violating the Open Meetings Act. Civil remedies include voiding any action that is taken in violation of the Open Meetings Act. So if you propose a rule in violation of the Open Meetings Act, a court can void that action and you'll have no rule in place or no rule proposed. There are also criminal penalties, up to $500, confinement in a county jail for 6 months, or both. So for best practices, avoid communications that involve a quorum, and during open meetings, confine your discussions to items specifically on the agenda. Here are some resources. Obviously, if you have any other questions, feel free to contact me. Now we're going to do the Administrative Procedure Act. I'm going to call this the APA, just for shortness. This is effectively how state agencies adopt rules and make a transparent process of the rulemaking system in the state of Texas. A rule is any implementation, interpretation, or prescription of law or policy. It is a generally applicable statement of the agency's policies. It's not as specific to an individual case. For example, a contested case hearing is not a rulemaking. A rule includes amendment or repeal of a prior rule. It does not solely relate to internal management of the agency, so our internal HR handbook is not a rule. But there are lots of different sources. So legislative changes, we'll be talking about HB 2059 today. Advisory board work groups, discussion of the advisory board, agency staff. For your rule review, we'll discuss that here in a minute. And rule petitions. Rule petitions are petitions from the public. So this would be a Texas resident, business entity in Texas, governmental subdivision, or a public or private organization here in the state of Texas that petitions the agency for adoption of a rule. Here's an overview of the process. I know these boxes are very small. I'm going to give you a summary of what's in these boxes. If you have any questions about this, feel free to email me. First, you have the idea for the rule. Then there's drafting and review of the rules. The blue box is the first step that this advisory board would take, which would be your consideration of the draft rule. We'll be considering an HB 2059 rule here today, so that would be the step that we were at with that. Proposing rules are filed with the Texas Register. Then the public has 30 days to comment. General Counsel Division reviews the comments, recommends changes, then we bring it back to this advisory board again. The Commission reviews the rule filing, comments, and recommendations from this advisory board and votes to adopt the rule. The adoption is filed again with the Register, and the rules can become effective 20 days after filing. There's another process, the rule review process, and this is triggered by statute every 4 years. We keep a schedule of the rules that need to be reviewed. These are rules that are already on the books. So every 4 years, the agency will publish a notice of intent to review the rules. Public has 30 days to provide comment about those rules and whether or not they think they need to be changed. General Counsel Division reviews those comments. Of course, then the Commission will review those filings, any recommendations about changing, and they may re-adopt the rule. Or they may send the rule back to the advisory board for comments and recommended changes about existing rules. So that's another way that you may have a rule change come to you through the rulemaking process. Here are some resources. Again, happy to provide any of these to you if you have any questions. The final act we'll be talking about is the Public Information Act. Sometimes you hear this referred to as the Open Records Act. This allows each person in the state information about the affairs of the government and the official acts of public officials and employees. All documents, records, and other information relating to official business is open to the public, but there are some exceptions. Public information includes any electronic communication, so texts, emails, anything else that you may have done, on any device that you have. So your personal phone, if you send an email regarding any business of this advisory board, it may still be subject to the Public Information Act. It will be construed liberally in favor of granting releases of information. So the process that the agency follows is that we receive a request. And it's an important point here, if you receive a request from the public that you think may be a Public Information Act request, please send that to agency staff. Don't try to interpret it yourself. We'll be happy to help you with that. Please send that along to us so that we can assist you and make sure that if it is actually a request, it gets processed correctly. If you get a request from us about some sort of information, for example, an email you may have or a document you may have in your possession, please respond to us very quickly because we have a 10-day deadline. We need to move promptly and quickly to gather the information that may be responsive to a request. We're also not permitted to request why this person wants the information. We have to comply with the request regardless of the substance of that. So there are some exceptions: date of birth, email, certain education documents, HIPAA information. Obviously, all of that will be protected from disclosure. Here are some resources. If you do have any questions about this, again, please contact us. And if you do receive anything that you may even possibly think is a request, please send that to staff. We'll be happy to help you out with that. So that's everything that we have today. If you have any questions, again, shoot me an email, and hopefully there won't be any issues. Thanks.
Thank you. Next item on the agenda is going to be E. It's public comment. Did anybody sign up for public comment? No, sir. Okay. And next, we're going to the staff reports. First one's going to be licensing division. Mr. Rivas.
Good morning, advisory board members. Happy New Year.
Happy
My
New
name
Year
is
to
Leonard
you.
Rivas with the licensing division. Since our last meeting, you have the licensing report in front of you with totals for fiscal year 2018, totals for fiscal year 2019, and so far for the first quarter for fiscal year 2020, we have issued 14 new licenses and renewed 81 renewals. Do you have any questions about the licensing report? Catherine?
Catherine Mize. I just saw something that I found interesting. And that is that the online renewals percentages are dropping? Am I reading that right?
That's, yeah, correct.
You have any idea why?
I don't have any idea why.
I just found that curious.
Maybe more people are opting to mail in their renewal instead of going online and renewing.
But online's easier.
It is easier.
Not for everybody.
Not for everybody.
There you go. There's the answer, not for everybody. I can certainly check on why that more people are choosing to mail in than.
Well, you don't have to. I just found it curious that it's dropping and.
Well, and that's only for the first quarter so far for this year. The first 3 months of fiscal year 2020.
Well, but maybe I'm reading this wrong. So I'm looking for right now, like at the licensed prosthetist orthotist
Yes.
report.
Right.
And so if you look at total for 2018, it was at 90%.
Right.
And total for 19 was at 70%. So that's actually the drop I'm
Yeah.
looking at.
Okay.
And I think, if I remember from looking over this last night, that every single one of them had a drop.
They
There
have.
may have, okay.
And it could be more because more people are opting to mail in their renewal than actually pay online. And I guess a few of you advisory board members have experienced issues with the online system.
If I may add, Ray
Sure.
Smith. I renewed my license last year, and I tried numerous times and kept having technical glitches. And it ultimately got to the point where I was panicking, basically, and I called, and a young lady helped me out on it and took care of it. But it was pretty frustrating. I kept going back, and it was the same thing kept happening. While I may not be the most computer literate individual, it was difficult. It was just, it wasn't very intuitive. And I kept just running into a dead end with this, and even had a couple other people in the office say, take a look at this and see if you see what I'm missing here. And it was just, like I say, you just run right up against the wall and couldn't go any further. So I don't know if that's something that you're getting from other people or not.
I can certainly check with our IT department and see why people are having difficulties renewing online. Also, since we don't receive the calls directly about individuals having issues renewing online, maybe Jacqueline from customer service can provide some insight.
Thank you.
Okay.
I'll be quiet now.
I do have a couple of staff updates. We have added one new person to our team, Steve Ledesma. He comes from the Texas Department of Agriculture. And we also lost a staff member, Vicki Watson, retired on December 31st. And we will start filling those positions hopefully in the next few weeks. Catherine at the
How many people do you have on your staff?
9.
Okay.
Catherine, at the last advisory board meeting, you brought up you would like additional information on the facility accreditation page. And so thank you for your draft. And with the help of Alex from General Counsel, Steve Eager from RPM, and April and myself from licensing, we added some additional questions on there and some links for individuals. Hopefully this will help the process move along a little quicker.
And those additions were under the, you click on facility
Accreditation.
accreditation. So they weren't, because when you first go onto our page, the ONP page, and I'm looking up because I'm sort of trying to envision what it looks like. But when you first go on our page, on the right side of the screen, there is a place that says FAQs.
Right.
And it's not there,
We didn't
correct?
put it there. We put it
Put it-
under, if you click on facility
Facility.
accreditation,
Okay,
we
that's
put
what I
it there.
thought. All right, so that's what you were referring to when you click on facility and you click on
Correct.
accreditation.
Right.
The list of, okay, information
Yes.
there, okay. Yes, thank you for doing that.
Oh, you're welcome. Thank you for your input. Also, we will start working on, the other thing you brought up was you wanted kind of like a flow chart from the time someone mails their application, what the process was, and if someone mailed their application certified, what the process was, and we'll start working on that also to put that on the website.
Oh, okay,
Okay?
thank you.
That concludes my report. You have any questions for me? No? Okay, thank
Thanks,
you.
Leonard, appreciate it. Next on the agenda is number 2, Customer Service Division.
Hello, good morning, board members. My name is Jacqueline Rush. I'm the customer service manager. New customer service manager started on August the 1st, so I'm pleased to be here with you. The numbers for emails and phone calls that you have in front of you haven't fluctuated very much. They remain on average about the same. The questions and inquiries that we get continue to be mainly about renewals, new applications, and license status. Be happy to answer any questions.
Okay, I've got a couple of questions. Do you know what the anticipated return on an email question is, the time frame?
Yeah, typically it varies this time of year after the holidays. An email coming in right now, you're going to want to give it at least 3 to 5 business days.
Okay. And is that something that we could perhaps put on, again, this is on the right side of the screen, if I'm envisioning it correctly, where you go down to see contact information and it gives the email address. Would it be reasonable to put something on there to say, if you email us, you can expect an answer within,
So that number-
7 days or 3 days? I mean, you could make it broad, but something.
Yeah, it's definitely something to look at. That number will fluctuate greatly. And currently, that is going to be something that is very unusual. It usually happens at the beginning of January, where we have a slight delay in response, and we have different strategies in terms of how we organize our staff to make up for the time that we were gone. But yeah, so that number would change throughout the year.
Throughout the year. So the delay right now is because you got so many emails in December,
For the most part, yes. Mhm.
and with time off and all of that kind of stuff. Okay. And then you have no way, I would assume, of knowing on your phone calls how many people give up and hang up on hold.
We have analytics where we can look into that.
You do?
And we can work with our advisory board staff in getting some information to you on that.
Okay. I didn't think you could pull that. I would love to know that. And I would also, I don't know, but in December, if you called and you were put on hold, after you were on hold for a period of time, it would say that you could reserve your place in line with your phone number, and they would call you back.
Yes, you can
And
elect.
It was not working. And I don't know, I haven't tried it recently, so
Yeah.
it may be working now, but I can tell you for a period of time in kind of early December, it was not working. I would put my phone number in, and then it would come back and say, the recording would say, we have technical difficulties, and we will put you back in line.
Okay.
Please hold.
My name is Trey Seals. I'm the Director of Customer Service Division. It's a great question. We did move to this location in June, and we have a new vendor as well. And that vendor and I and our team have been working to make sure everything is functioning correctly. And the callback feature is one of those features that we noticed that was not working as it should. We've been in communication with the vendor this last week and periodically since June, just checking on various features and functionality. We're almost done with the project. I can say that the callback feature is working as of now. We are
Okay.
testing it regularly to ensure that it is continuing to work the way it should. There are a couple things that we need to do to add more feature to it. We, for example, just last week had to add the pound sign for that input to go through so it didn't put you back in the queue. So we noticed that we had more in queue than were able to leave callback, which was like, that's a problem. So it is something that we watch, and we are able to tell who has hung up at what point they hung up. So there are a lot of things that we can see in the data. What I will say is that because of our functional alignment, we take all calls for initial calls for the entire agency.
Right.
So I may not be able to drill down to
To OMP,
specifically
yeah.
OMP. We can get close, but I won't. It's more aggregate data. So I just say that with that caveat, we can get you overall numbers, but it won't be specific to OMP.
Okay. And I assume that there's no way to really improve that, the hold issue. We can talk about this later, or if there's a more appropriate place, but one of the problems for at least me, but I'm going to speak for other professionals. Because we see patients, because it's scheduled patient care, it's hard, if I'm scheduled with patient care from 8:30 to 5, it's hard to be on hold for 30 minutes because I have a patient to go see.
Absolutely.
So I can't sit there on hold. And so the callback feature is nice, except if I get the callback when I'm in the patient room, I can't take it.
Yes.
So I'm kind of in trouble there too.
Yes.
Now, what I don't know, because I guess I haven't really looked at this, but is your call center open after 5 o'clock? Is it open till 6?
Our operating hours are 7 a.m. to 6 p.m. Monday through Friday.
Okay, so the answer to that is call after 5 o'clock.
It depends on the day of the week. Today it's going to be busy through till 6. I can pretty much guarantee.
Because it's Monday?
Because it's Monday. The other thing I will say, and we talked about mentioning this or not, and I will take the opportunity to say we are hiring due to the end of the legislative session, the end of the fiscal year. There is typically movement after a legislative session year. We've had several folks promote within the division and within the agency, and outside the agency, other state agencies. So there's been a lot of movement, and we are needing customer service representatives. And so it's a constant challenge at this time of year. We knew January was coming, and we also know that we need more people, and we've been diligently interviewing and getting more people in. There is a lead time to get folks, trained up, because it is not it's about a 4-week process to get folks, 4 to 6 weeks, depending on the person, get them up to speed and taking calls. So we do have folks coming out of training, and that will help with the hold times. Our issue is having folks in the queue to take the calls. And if that's not the case, then there will be higher hold times. But that's not the entire answer. The other part of that is we took off as an agency. Yes, things slow down a bit, so it does take a little longer. That means that the applications may not get processed as quickly, which drives our phone calls. So we
Right.
are basically responding to an ever-fluctuating input of calls. We don't control when folks call. And
Right.
what you're speaking to on the callback feature that we do not have, but is something we're looking at determining how we might be able to make that work, is to schedule your callback at a time that is convenient to you, within the parameters of our operating hours and the day
Right,
of the week.
right.
That's something we've been looking at for our website through our, you can send a secure email via our website at tdlr.texas.gov/help. And we're thinking about creating a special form for, what's the best time to call you, so that we can try and coordinate that. Unfortunately, that doesn't fit into the automated part of the phone system. So we've got challenges that we continue to work with and try to figure out how to provide better service, especially for folks who can't hold. Always, though, the email is the other way if it is.
Well, and so
the case
that's
that you
why I
can't.
asked about notifying when to anticipate a return email. Because, for instance, you're trying to get your application in, your boss wants you to get licensed as soon as possible because they need to schedule patients, it's backing up, you're in trouble. You call, you're put on hold several times, you can't get through, so you shoot an email, and a week goes by and you haven't heard anything back. And so for a week, your hands are tied, you can't do anything with your application, you don't know what to do, and you get frustrated.
Of course, yeah.
So that's the perspective that I'm coming to. So if you knew, I'm going to send this email, and right here it says that it's going to be 3 to 5 days before I hear back, at least I know to anticipate that. And I'm not looking at my inbox every day, every hour, going, where's my answer?
Agreed. Yeah, we're constantly looking at ways to set your realistic expectations. We try to do that over the phone when we do speak with you. But yeah, it is a moving target to tell you based on how many applications we have in queue, how many
Right.
calls we have in queue, how many emails we need to respond to, how many staff we have on hand, what that time frame will be to return. I will say that we are working, several divisions have been working overtime to keep up and to catch up. So it's something we definitely are aware of and definitely want to provide that service and set better expectations. So it's something we're always looking to improve.
Okay, thank you.
Thank you.
I've got a quick question.
Sure.
Just for clarification, you had mentioned that you've got a new contractor. Is it a software-based issue to a degree, or is it just strictly a manpower issue where you have contractors that are answering the phones?
Right.
And maybe how many of those are state employees, or how, can you?
Got it.
clarify that a little bit?
Sure. What I was referring to is we have a new software vendor for our phone, automated call distribution software vendor. So that's the new relationship. We also have new employees. So it could be, there's never a simple answer to this kind of challenge. It is, multiple factors that are affecting our service level. But yeah, we do have a new vendor, and we are still working out the kinks on the actual way the software is supposed to work. And we're in contact with them, putting pressure on them to fix these issues when we encounter them. But
How often generally has software vendors been, do they change?
oh,
Any
it's
idea?
been years.
Okay.
Yeah, this was a long time coming after the phase 2 that. So when we took over the regulation of the extra Department of State, formerly Department of State Health Services regulated programs, that phase 2 we call it, our volume increased. The previous vendor that we had was premise-based. We were at our limit with that particular solution because it had been several years and we'd had a lot of growth in that time. So we went to the cloud, but to get to the cloud took quite an effort and several projects and with our project management office, our IT division, and it was a successful project. And this is just the finishing up of the actual phase 2 of that particular implementation. And there are always little things that you find
Thank you.
that need to be corrected.
How many new programs has TDLR taken over in the last 4 years?
4 years? Well,
Can you count that high?
our new deputy is saying at least 15.
At least 15.
At least 15.
Because I know it's a ton.
It's, yeah, it's a
So-
few, yeah.
I mean, the increasing volume, sheer volume of what you guys are having to deal with is mind-boggling. I have a
Mary
feeling.
Winston, TDLR, you're right, Catherine, and that's why, as Trey was saying, it was high time. The old vendor could not handle what we have going on now. And so customer service uses, people think customer service and they think, oh, people answering the phones, which is definitely part of it. But it's like a constant move in software or tweaking, because we did go to a new vendor. And then we find things, okay, to better accommodate this, we need to add that, and then they do. So some of the things that you all have brought up today, that Trace made note of, we've made note of over here, will also be brought back to the vendor as to when that can be helpful. We do have, I know I personally hired somebody out of customer service, so there's
So
been
you're part of the problem.
part of the problem to a larger solution. But, so I do know they do have some openings, and when we see, for instance, the hold times, it's like, why can't they get this? Oh, we need to add, I'm old, I'll say the number sign, but now it's hashtag. So, so that sounds so simple, but it had to be researched to where we get it. And the vendor's been really cooperative with that. But it's just been they steadily move. Have you ever been up to their room? Okay, if you have like 5 minutes, just the board is amazing and the technology that goes behind customer service. So
Right.
times are up now, and when they're up, no one is happy in customer service. They are hardest on themselves before anyone gets to them, and trust me, other people get to them. But trying to work that kink out and get us back on track, so.
Has the legislature given you enough of a budget to hire enough people, or is that part of the problem too?
I wouldn't be able to speak to that. But
No, well, currently, the issue is not having the ability to hire more people. It's getting the people here. Trey has been in a constant interviewing
Yeah.
swimming pool or tidal wave or whatever. And once you get them in, you have about 6 weeks to train them, some 4 to 6 weeks to train them. So sometimes those lull times are because we will have like a new crop of folks coming into customer service. And I'm gonna, like, if you're not in a rush after the meeting, I want to grab you just to run up
I'd
there
love
for a
to see
minute.
it.
Yeah.
Yeah.
So you can see just like on the surface of what, and the whole board, on the surface of what they're, working with and trying to work with. So the things you said today, and I've seen Trey jotting down as Jacqueline's talking, it's just more stuff for them to work on, and it's what they do. And they love to solve their own problems because they are so hard on themselves. The rest is like, okay, we know you're doing it, but Trey is really hard on himself, Jacqueline too. And so just trying to figure out that problem, and when they do, they're happy, and then they go to the next thing. So, but we'll give a little field trip. I've just volunteered.
Yeah, that's okay.
Sorry,
We love to
customer
show off
service.
what we're doing.
David Arns, I have two questions. And it's just to enlighten me, you may already be doing this. Do you have on your new system separate phone numbers for the separate divisions that you get customer service for that all ring into the same customer? I'm thinking analytics, right? Because you said you can't drill down into O&P. If you bought another number that was for O&P customer service and a number for massage therapy customer service, they all feed into the same place, but then you could at least track it.
Right.
That's, I know in some industries that's done. I didn't know if that's something you do or not.
I can explain that really quickly now, or we can talk about it when if you would like to come up. But I'm happy to explain that. What we've done, we have automated speech recognition as part of the new tool. We are tuning it, is the term in the industry, to actually pick up the actual term that the customer speaks when they call in, that they're calling for that specific industry, and then it goes into the queue for the analytical data for after the fact. Before that, our agents actually disposition is what it's called, or wrap up at the end of the call, and they choose the industry for which that call was made.
Okay. And one other thing I was wondering about was, do you track the issues that are called in on?
Oh, yes.
Because like our list here just says you had this number of calls this year and this number of calls last year. There's no breakdown of, or is there a way to break down what the issues are that are coming in on those calls?
So on that disposition list, it does break down by the particular issue that it might be. We can drill down that way, but that's like set, right? So you have what you have. We review it regularly, see if it needs to be updated. The other way that we do that is through our customer relationship management software, which we do have a CRM, and we use it mainly to track when we've promised something to a customer, either our division or somewhere in the agency. And so we do that to try to keep up with what we've promised so that we follow through on it and see that it is actually completed, whatever it was that we promised.
A good CRM tool makes a huge difference.
Yes. Yeah.
Yeah, that's all I had. Thank you.
Thanks.
So if you've got that, is there a way on this information that we see to see how many questions are regarding practitioner applications and how many are regarding facility applications and how many is a rules question?
Sure.
Is that something you could provide us with?
We don't have it that way right now. There's a fine balance we try to make between what the agent has to do on the call in terms of answering the question or getting the question to the right person. And they only have so much time because they got to get to the next call. So we could have them doing a lot of tagging and dispositioning at the end of the call. It is something we try to find a balance on. Is like, well, how much data do we actually need to collect before we move on to the next call, and what do we have to let go so that we can move on to the next call? So that's constant juggling. We find that sweet spot, and then something will change. A policy will change. A law will change. Legislature will do something to add new programs, and then we have to find the new sweet spot. So we're constantly chasing that target.
Mary Winston, TDLR. I don't know how close we can get, Catherine, to what you're asking for, but we'll see how close we can get there.
Right.
Because what I'm hearing Trey say is we don't know how accurate that is. So that may be plus or minus whatever, but
Yeah.
we'll see how close we can get
Okay.
to that.
Well, I'm just wondering if you could narrow it, and we saw that 70% of the questions pertain to practitioner applications, then there's something missing on the website.
Absolutely.
That if we could put on the website or put in FAQs on the website, it would reduce your phone calls perhaps.
Yes. So you're speaking to something that we aspire to do and have done in the past and are trying to get back there once we get fully staffed, and that is process improvement. We use, and Jacqueline just whispered in my ear, Teams is our chat system that we use, and it is recorded. We can analyze what those chats were about to determine what were the calls about, so we can put in Teams O&P and figure out what were the calls for that day. It is manual right now, and we always are looking for ways to automate processes, right?
Right.
But we take that information and we then figure out what is the recommendation. And we've been working very closely with our Office of Strategic Communication regarding the website, and they have done a really wonderful job of redoing several sites to make them more user-friendly for the end user, instead of our perspective.
Right.
And to make it more clear what you were speaking to earlier, you're asking for is a journey map to explain, here is the steps you're about to embark upon, here's what to expect, here are the pitfalls, here's what you need to prepare for, because if you're going from in training to a more formal license to the next license, there's several things you need to know as you go into the work. So those are initiatives that we participate in and have actually begun to give more information to different programs based on the volume of calls that we get. So, but we can certainly turn our attention to this program as well.
David Arns again. That information, even not even just for process improvement, but say if you're getting a lot of questions about how a rule is worded, maybe that's something we as an advisory board need to review and clarify language in the rules so that people can understand it better. So. There's one other thing I was going to ask you, and now I forgot what it was, so I guess it wasn't that important.
Well, I'll say maybe you'll think of it as our. Go ahead.
I just remembered. Do you have and this is my ignorance on the site because I don't go on there very often. As a patient, I don't have a lot of use on there, but do you have online chat?
We do not.
Do not have. Is there privacy rules or something that would prevent that? Or
No, it's the challenge of having the right people. The number of people, the actual specific expertise in taking phone calls while answering chat. There's a theme or a trend in the industry was for omni-channel and like a super agent who could take calls and answer 3 to 4 chats at the same time. That
doesn't work.
Not in our industry. We're not in our work where we need to know 39 industries to a certain degree. We don't get into, if it's beyond a general inquiry, we're going to forward it on to the subject matter experts. And so it's not something, we've looked at it in the past, but it's not something that we've been able to implement.
I'm not in this industry, I'm a user, but in the industry in which I work, the online chat feature is great because I can start the chat and then keep working.
Right.
And then get a response, and I'm not sitting here with a phone up against my head or with it on voice on the desk. So I don't know if it's something to consider again or not.
It is something we would love to do. It is something that is going to take, once we figure out hiring, number one, and then the software, once what we have now, we haven't included chat in our current solution, and figuring out, okay, what's next. We're always looking for what's next because the target continually moves. So yeah, it is an ongoing puzzle that we are working every day to solve. So
That's an interesting
Okay.
idea.
all
I'll
right.
shut up now. Thank you.
No, great questions. Thank you. Any others? All right.
Thank you, Trey.
Thank you.
Jacqueline, appreciate it. Next on the agenda is going to be the Enforcement Division, number 3.
Good morning, board members. Happy New Year.
Happy New Year to you, too. Good
Thank
morning.
you. My name is Jessica Hurtado, and I'm a prosecutor in the Enforcement Division. In the staff report, you can see that we have the statistics listed for the current fiscal year from September 1st through November. We've opened 6 cases, and we've resolved 5 cases. No final orders at this time for this meeting. And you can see how that compares with the last fiscal year where we opened 11 cases and resolved 16. Right now, we have 8 cases that are currently open in the program. 2 are with the investigator and 6 are with the prosecutor. And
Say that one more time, the
Sure.
last part?
2 cases are currently assigned to an investigator.
2.
Yeah, and the rest are with the prosecutor. And with that, I'll be happy to answer any questions that you have.
Is there a way, the statistics that you guys provide are great. Is there a way to drill those down a little bit more as well for the advisory board? Again, along the lines of what he said, if a ton of calls are coming in about a specific rule, maybe we need to reword the rule. or put more information on the website. If there's a predominant number of cases that involve a certain type of subject matter, without necessarily revealing the case, because I know you can't do that, but maybe even after the fact, if we knew the essence of the cases, is there something that we could address to help communicate and educate the public better?
Ms.
Yeah.
Mize, I'm sorry, Jessica. Christina Kaiser, Deputy Executive Director. I can tell you that when there are cases that have been resolved, there will be a summary of those cases in your enforcement report, and you've probably seen those in the past, a little paragraph that explains the outcome of cases where a final order was entered.
Okay.
And I can, this might be a discussion that you want to put in front of your enforcement work group, so that your work group members from the advisory board can talk with staff in more detail with the right people in the room, because really this is a statistics question about what you can pull out of legal files, our case management system, and Jessica probably doesn't have that information.
Got it.
But it's also, to a certain extent, it's sort of a policy question, and I can tell you that generally TDLR's position has been, if a case does not result in a final order where someone is adjudicated to have committed a violation, we're not inclined to talk about the substance, the substance of the complaint, because the person was not found to have ultimately committed the violation. Does that make sense? But it's definitely something that can be talked about. I would recommend that for an advisory board discussion or a work group discussion.
Work group, okay.
All right, any other questions? All right, thank you very much.
Thank you, Jessica, appreciate it. Next on the agenda is going to be Education and Examination Division.
Good morning, Mr. Chair, advisory board members. Happy New Year.
Happy New Year to you, dude. Good morning.
My name is Marco Rodriguez, and I'm going to be presenting the report for the Education and Examination Division. You should have the statistics report in front of you. Do you guys have any questions?
Anyone have questions for Marco?
Is part of your report the continuing ed audits as well?
Yes.
How does somebody know when they've received an audit?
How
A
do they know?
professional? Yeah. Is it,
Well, we send them an audit letter 90 days before the expiration date.
okay. I'm probably going to get one now.
You shouldn't have asked.
Well,
I probably just labeled myself.
well, the system does a random, a selection of the audits. So
Okay, I just wondered, because obviously I haven't received that letter, and so I didn't know how many people how people were notified.
Quit announcing it, and maybe they won't send you one.
I've already doomed myself.
Showing up at the IRS and saying, I didn't file my taxes.
Don't you want to audit me? Okay, a letter 90 days in advance. Okay, and it's always by mail. Is there an email as well, or?
no, I think we're working on trying to send emails. We don't have emails for everyone, so we might do that in the near future. Send
Okay.
them an email as well as
As
a
the
letter,
letter.
or just one. I don't know, but
Yeah.
we're working on that.
That might be a good idea, because people move or change employment and they don't necessarily remember to let TDLR know that they've got to change.
Yeah.
So I could see a letter going, for instance, right now, if you mailed me a letter, I'm not sure if it would go to my home or if it would go to my last place that I officially worked.
Well, the letters are sent to the mailing address. Whatever we have as mailing address, that's where the letter goes.
Yeah, I don't know what my mailing address with you guys is.
Quit turning
Okay.
yourself in.
Yeah.
I got the audit coming, don't I?
Exactly.
A lot of self-incrimination going on here.
It's okay, I signed up for a continuing ed class this year with the academy,
Okay.
so I'll be good.
All right.
Do you need to be
Thank you.
Mirandized?
Yeah, I do. Thank you.
Thank you. Any
Thank
more
you.
questions?
Anyone
No?
else?
No, sir.
Thanks,
Okay,
Marco,
thank you.
appreciate it.
Thank you.
Next on the agenda is going to be the Regulatory Program Management Division.
Good morning, everybody. Advisory board members, and Happy New
Morning.
Year again.
Good morning.
My name is Steve Eaker. I'm with Regulatory Program Management, and I'm here to give you an update on what we've been up to. First, I want to welcome our new executive assistant, Amanda Smith, who's a wonderful person from DSHS. And I'm not just saying that because she was my secret Santa. Very nice gift. Other things happening, wanted to let you know the changes required by Article 11 of House Bill 2847 that deregulated the orthotics and prosthetics technician registration are moving through the approval process. Staff participated in work groups and meetings and provided fiscal analysis on the impacts of House Bill 2059 related to CE requirements for human trafficking, which we'll talk about a little bit more in depth later. Those changes are before the advisory board today. RPM staff has also been working with other divisions at as TDLR continues to integrate and improve the orthotics and prosthetics program, and our forms are currently under review. The webpage has been updated, as Leonard spoke about, related to the FAQs for facility licensure. We had some questions about the documentation and what kind of photos were required, and would an inspection be required prior to opening the business, and things of that nature. And those are addressed on the updated webpage. MHP staff continue to assist licensing division staff in reviewing application documentation and customer service division staff with emails. In terms of public outreach, medical and health professions program specialist Stuart Myrick and myself staffed a booth at the Texas Association of Orthotics and Prosthetics annual meeting in San Antonio in April, and that was very interesting and educational, along with the Texas chapter of the American Academy of Orthotists and Prosthetists annual meeting in Houston at the Baylor College of Medicine in August. We plan to attend the new Texas Society of Orthotic and Prosthetic Professionals meeting in 2020, as soon as that we find out when that is going to occur. And if you are aware of any outreach opportunities for us, please contact me. For our particular unit, Senate Bill 202 that transferred the 13 health professions from DSHS to TDLR required TDLR to report annually to the legislature on the implementation and transfer of the programs. TDLR sent the final report to the legislature in December 2019, and that's report is in your packet, and it's also available on our webpage. During the last legislative session, we all reviewed a lot of bills and analyzed the impact of the proposed legislation and served as cost estimate teams for bills that relate to the medical and health profession, as well as quite a few other programs at TDLR. And we continue to help implement the bills that passed, including House Bill 2847 and 2059. We've also produced and distributed 9 issues of the TDLR Health Monitor, which is our online newsletter. The latest issue can be found on our program webpage. Links to the previous issues are also there on the agency newsletters, under agency newsletters on our TDLR webpage. If you have any topics or ideas, again, please contact me. One of the topics covered was Senate Bill 1264 regarding balanced billing, and I want to talk to you all a little bit more about that. And that was a hot topic in the last legislative session. Senate Bill 1264 protects consumers from surprise medical bills and emergencies, and in cases where consumers had no choice of providers. The bill prohibits balance billing by out-of-network providers to state-regulated insurance plan enrollees. A balance bill is defined as a bill that exceeds the applicable co-payment, co-insurance, and deductible under an enrollee's health care plan. So enrollees in these regulated plans cannot be balance billed for emergency services provided by non-network facilities and providers, emergency services provided at an in-network facility by a non-network provider, or situations where an enrollee does not have a choice of providers in an in-network facility. So the bill provides an exception for non-emergency care. If an enrollee chooses an out-of-network provider for non-emergency care, the enrollee must sign a waiver that is a form designed by the Texas Department of Insurance to acknowledge their billing, that they're waiving their rights and protections. The bill also authorizes TDLR to adopt rules and take disciplinary action against TDLR-regulated healthcare providers for violations regarding balance billing. So what bills who is covered. This is a state law and rule, and applies to the Texas Department of Insurance and the plans that they regulate. So these state-regulated programs by TDI cover 1.1 million, or about 16% of Texans. Insurance cards for state-regulated plans have either a DOI or a TDI on them. It's usually in the upper right or the lower left, or it's somewhere on there. In your handout is a link to that, and that link is also in the press release. We have a link to the Department of Insurance webpage. It's in the article we had in the Health Monitor, and it's also on our webpage for each health-related program.
So I have a question.
Yeah.
You said 16% of insured Texans have a health plan that's regulated by TDI?
Yes,
Why only 16%?
because they only regulate certain programs, self-funded programs that elect to be regulated by the Texas Department of Insurance, but they also regulate the Employee Retirement System, ERS, TRS, the Teachers Retirement System, and TRS Active Care. So it's not an overarching federal mandate.
Right.
And-
So if a Texan has an ERISA policy, that's how I refer to them. If it's an ERISA policy, it's under federal regulation, so Texas, this is not going to apply to those folks.
I would contact the Department of Insurance for specific questions like that, and we can also help find that out.
So back to what you said, the notification on the card, it'll say
Mhm.
DOI or TDI on the front of their
Mhm.
health
It'll be
card.
on their card.
So if it's
And
not on there,
then
then they're not
then
protected.
they're
So
not
this bill,
protected.
in essence, only protects about 16% of the Texans.
Correct.
That's really low. That's too
Correct.
bad.
It's a start in the.
Start.
It's a start.
So we need a federal balanced billing law.
Right.
Okay.
And I'll talk a little bit more about that. So, and there's also other caveats to the bill. Providers who work, so the people impacted, providers who work in diagnostic imaging, emergency care, facilities, and laboratories, and bill the health plans outlined above. So what is a facility? Facility is an ambulatory surgical center, licensed under Health and Safety Code, Chapter 243. A birthing center, licensed under Health and Safety Code, Chapter 244. A hospital, licensed under Health and Safety Code 241, or freestanding emergency medical care facility licensed under Health and Safety Code 254, or a freestanding emergency medical care facility that is exempt from the licensing requirements under Health and Safety Code 254. So these are very specific places. So currently, the status of the bill is it went into effect on January 1st for services or supplies provided on or after that date. TDI has adopted amendments and added new sections to the emergency code to implement the provisions of the bill. TDI also adopted emergency rules to implement the waiver provisions of the bill. The waiver addresses the exceptions to the balanced billing prohibitions. So as a TDLR licensee, if you work in a facility that's an ambulatory surgical care facility, a hospital, a birthing center, or one of these freestanding emergency care facilities, and you provide care to an enrollee in a state-regulated plan, then you need to be aware of your responsibilities, and you intend to balance bill them. If you do not intend to balance bill somebody, then that's
not a
great.
problem. So would that pertain to our professionals who, you don't work for the emergency room, but you go provide care to the patient in the emergency room when contacted?
So that would be if you were a non-network provider working in an in-network facility, you would have to, because you're not under contract with that facility, with whatever system they may have, then you would need to inform them. But that would, if it was an emergency care situation, then they would be protected regardless if they were enrolled in a state-regulated plan. TDI, there's an email in that handout, and for specific questions, that would be a great place to start.
Okay.
And we can help as well with trying to interpret it, but it is fairly complicated.
Yeah, I'm just trying to figure out if this ever affects our providers in our profession.
Guess it just depends if they're connected to an ER. you know, they
Or if you're, in a facility,
working with any.
in a facility.
Okay.
Okay, and that's all I have.
Thank you.
Any other questions? Thank you.
Thank you very much, Steve.
We will let you know
I'm s-
when we get a date for our next professional meeting in 2020.
Okay, yes. Great, thank you.
Thank you.
It is 11 o'clock, so I'm going to request a break, 10-minute, let's do a 15-minute break, and then we will reconvene, so. It is 11:16. The next item on the agenda, we're still under F, and we have the Field Inspections Division report.
Hello, hi. I'm Tanya Guthrow, the Director of Field Inspections.
Good morning.
Good morning. In our report, the first item you'll see is our most common violations found during inspections. And I always like to kind of point out that these are not necessarily violations that enforcement has taken action on. It depends on, if it's a serious violation, if there's been a report sent to enforcement, and then the prosecutors decide what to do. I wanted to also point out that item number 7 is actually just a repeat of item number 5. So if you would note that that needs to be deleted.
I thought maybe it was repeated for emphasis.
It is very important, which you're going to put in red next time. And so those are our most common violations. As you can see, most of these have to do with safety and sanitation, and then there's some administrative and licensing activities that were written. Next, we have some personnel updates. Along with the rest of the agency, we've had some additional work added to our workload, and we are moving from 3 regions to 4 regions. I want to say congratulations to Juan Munez, who was selected to be our new Central Region Manager. And so we'll have a Central Region, South Region, East Region, and a North Region. So we've just kind of divided the state up into 4 big parts. Also, congratulations to inspectors who were able to be promoted from Inspector 4s to Inspector 5s. I always like to give people a shout out if they've been able to be promoted, and that's Heather Allen, Tisha Cantu, Lance Carolyn, Abraham Delgado, Michael Hanna, and Jorge Vega. Also, we have to say thank you and congratulations to Julianne Crocker, who was our lead facilitator, and she gathered our numbers and analyzed our data. She's found another, she's been promoted to another area at TDLR. So we're sorry to see her go, but we want to say a big thank you to her and wish her well.
Did she hire her too?
No, it wasn't, no, not this time. But we always have to watch out, yeah. Everywhere, people are looking to hire good people. And so congratulations to Julianne. And we do have a replacement coming and starting with us on February the 3rd. And then we have our statistics. You can see that for the first quarter of FY 2020, we've done 72 inspections. And that concludes our report. Do you guys have any questions?
I have a couple.
Okay.
Are you all are you able to keep up with the, I think the goal is an inspection every 2 years?
That's correct.
For every facility?
That's correct.
Are you staying on track for that?
We are not completely on track, but I think we're doing a pretty good job. One thing to note is in FY 2018, which you don't see here, we did a total of 120 inspections. So if you kind of do the 120 to the 78, that still leaves us not at the full population for facilities, but we're not far off. So we are, I do know, though, that there are some facilities we're still working on getting to that it's hard to make the scheduling because they're not, open 8 to 5 every weekday. So, yeah. We are getting more inspectors, though, as part of the changes going on throughout the agency. So we're going to be going through a period of hiring some additional entry-level inspectors. But also with the change to the 4 regions, we have 1 inspector who is dedicated in each region for this program, which is not, we would love to put everybody on it, but it's, given the population, that means 4 inspectors for the number of facilities here. I think it's pretty good.
Is there anything that we can do to help you guys as far as rules are concerned, as making them clearer, changing something?
Well, I think one thing to note is we did appreciate working with you guys on the reference guide. It made it very real for us, and we understood the practical application of it. But the other thing to note is in this first quarter of FY 2020, we did 72 inspections. But if you look at our most common violations, you don't see it here, but the most common violation was number 1, and it was written 16 times. So as far as the number of violations being written, it's not excessive, and most of them are not very, very serious. So I think we're okay for now.
Okay.
Yeah.
Ray Smith,
Yes, sir.
can you explain what the difference is between a field inspector level 4 and 5 is?
Well, we like to think of our Inspector 5s as folks who have reached a level of experience and knowledge of a variety of programs that they can also act as trainers, in the field trainers. So we want to make sure that any entry-level inspectors are being trained in the field by folks with a lot of experience, not only with the programs, but in how to just manage being an inspector.
So is an entry-level inspector a level 1?
No, we start at a level 3, and actually, this is just kind of off the topic a little bit, but we recently moved, the state moved inspectors from Inspector 5s used to be called Inspector 6s, but because of whatever reason, they've now classified somebody. We used to call an Inspector 6 as an Inspector 5. So our folks start out as Inspector 3s, which I think is good, and then they can potentially move up to Inspector 4s, and then now there's a possibility of them being an Inspector 5.
Thank you.
Anything else?
That you start at 3, you don't start at 1. Makes you feel important right off the bat, right?
Well, yes, absolutely. We need to be competitive.
It's kind of like the original Star Wars trilogy. Start in the middle. And
Oh, no, now we're
work your
going
way
to, they're going to love that reference. Thank you.
That's what I'm here for.
Okay, any other questions? No?
Thank
All
you,
right,
Tom,
thanks.
appreciate it. Next on the agenda is item number 7, Executive Office.
Good morning, Chairman Mojica and members. I'm Christina Kaiser. I'm the Deputy Executive Director for TDLR for Regulatory Affairs, and I'm going to be offering the Executive Office's staff report today. I'll start by telling you a little bit about the Sunset Review. TDLR is currently under the Sunset Review process. The review began in October of last year, and it runs through about May of this year. Prior to the holidays, we held 27 meetings of agency staff with Sunset staff for them to learn about our agency. In January and going forward, we already have 13 more meetings scheduled. So there's a lot going on in the process. Sunset is still in the data gathering portion of the review. And while this Sunset Review does not strictly include your program, because of the date on which your program was transferred to TDLR, you or members of your industry are very welcome to offer input or feedback about TDLR's processes, TDLR's performance in any area. If you would like to do that, that could be done on Sunset's website. A couple of anticipated dates in the future, and now these are subject to change based on the needs and the other obligations of the Sunset staff who are very busy, but we anticipate that the Sunset's staff report about TDLR will be published in May of this year. After publication, there will be a public hearing of the actual Sunset Commission, the body, about that report. That's anticipated for July of this year. At that July public hearing, public testimony will be taken about TDLR. Around August of this year, we anticipate there will be a decision meeting of the Sunset Commission about TDLR. At the decision meeting, there is no public testimony taken, and that's the point at which the actual Sunset Commission considers the recommendations made by the Sunset staff, who are right now over here studying our agency. The Sunset Commission may ultimately accept, reject, or modify recommendations made by the Sunset staff. And the Sunset Commission may also bring forward their own new issues or recommendations during the decision meeting. So the expected outcomes of a Sunset review, first and most importantly, we hope that the Sunset Commission will conclude that TDLR should continue to exist, that it continues to add some value to the state of Texas. Typically what you see out of a Sunset review are recommendations for statutory changes that would then be taken up in the form of a bill in the next legislative session. We also may see some recommendations for management actions, and those are things that don't need a law change, but they are just recommendations for some kind of change in how TDLR does its business. Also on the agenda for the Executive Office staff report, we always like to provide some information about the extent to which people have visited TDLR's website as it relates to your program in particular. This kind of relates back to some of the questions that Ms. Mize was asking earlier, but specifically for the website. So for the last 6 months of calendar 2019, so from July 1 through December 31 of 2019, the Orthotists and Prosthetists portion of TDLR's website was visited 9,166 times, or for an average of about 50 times a day. 82% of those visitors accessed the site from a desktop computer, 16% from a smartphone, and 2% from a tablet. And the top reasons for visiting the website were, number one was to view the administrative rules. Second was forms. To renew an individual license was third. Fourth was to visit the frequently asked questions. And then fifth was information on facility accreditation. I would also like to tell you a little bit about some personnel changes in the executive office. Carla James, who was a deputy executive director for TDLR for about 3 years, retired on November 30th. Brian decided that because of the growth in TDLR's responsibilities, he needed to hire 2 people to take Carla's place. And so he hired David Gonzalez, who was formerly the director of the Regulatory Program Management Division, as one of the deputy executive directors, and myself, Christina Kaiser, as the other deputy executive director. So we started in our positions on December 1st. And so we're joining Mike Arizmendez, who was already a deputy executive director. So now there are 3 of us at the deputy level reporting directly up to Brian. And each one of us is responsible for a certain number of the agency's divisions. Because David and I were promoted, we then had to hire new directors for the 2 divisions that we were responsible for. So I'd like to also recognize Charlotte Melder is now the director of the Regulatory Program Management Division, and Ron Foster is now the director of the Enforcement Division. And I look forward to working with all these folks in their new roles, and they've already hit the ground running. And I'm going to hand the mic to Mary Winston, who has one other item to share with you as part of the Executive Office report.
I had to make sure it was still morning. It is. Good morning. The last item under the Executive Report D, introduction of anti-trafficking unit. We actually have just finished completing the hiring for this unit, and I didn't have all of the folks come down to be introduced this morning because they're in the middle of training. And this morning, actually all day, is enforcement training, and they have an extensive training module to go through. TDLR was granted during the last legislative session funding appropriations to actually hire an anti-trafficking team. We currently license, in part of those new license types that we got not long ago, I think it was November 1, 2017, is when we brought on massage, a former DSHS program. With that, we have become very aware of phenomenon within that licensed body of not only massage establishments, but what is commonly known as a massage parlor, but what we like to refer to, and the professionals who do this type of work, as illicit massage businesses, IMBs. Our field inspections team does have periodic inspections that they conduct of these businesses, and our complaints enforcement division is complaint-based. So where does that leave us? Texas is a really big old state, right? So to fill in that gap between those inspections for that specific license type, as well as we sometimes find labor trafficking in other types of our license types, for instance, cosmetology. To fill in the gap between the complaint-based inspections or investigations and the periodic inspections, we have currently a team of 8 prevention liaisons or trafficking prevention liaisons. We have 1 employee who has been here and who was just kind of like the solo person really trying to take this on in this giant state. But it was before we got appropriation. So now we have added on to Ms. Jennifer Harless, we have Brian Cottle, Ray Carswell, Gloria Newton, Alex Ortiz, Jordan Strain, Chuck Winkler, and Jennifer Ignacio. And this group brings various experience from grant-based projects, from domestic violence-based, from our own investigative team, from licensing. So they're being trained on every other thing that they can be within TDLR, and we have training outside of TDLR. We've had directors of child trafficking from the governor's office to come in. I was actually just emailing someone who is out of Waco who started a trafficking unit, who I've gone to different trainings with while working with this group. And at a certain point, once they're in, and done with the training, we'll bring them down just to say hello. But I didn't want to interrupt that training. But this is part of what we were gifted with a while ago with this program, and what we became really aware of that we needed to tackle. And the legislature gave a nod to that and gave money for us to fulfill that. So that is what I wanted to report today for D.
Ray Smith, I've got a question for you, Mary.
Sure.
So, are you finding that a large number of employees in the massage therapy business are, I will say, illegal, do not have credentials, or they're actually in slave trade, or in trafficking, bring them here and have them work for nothing? What are you finding there?
So, new group. So we are still doing the analytics on all of that. For the properly licensed, above board massage establishments, we're not finding that. We have a massage therapy board that we have. Those folks, legitimate, are paying salaries according to state and federal wages, but we do know that there are businesses out there. We actually have a presentation that maybe we'll do another time about what to look for a legitimate establishment and for an illicit massage business. And you can kind of tell the difference. So for those, we're accumulating numbers and analytics for what those look like, for where they advertise, for where we can find them. And we partner with, of course, Polaris, which is a national organization that has gathered information, and we're trying to work with, we're also part of a human trafficking coordinating council that was put forth by the legislature during this last session, and trying to come up with ways to defeat this kind of activity. And our part of this, massage is only one area that obviously that this happens in, but it's relevant to TDLR, and in our little and not so little section of how we work with members of the state, I think currently we issue over 800,000 licenses. So some of those are massage therapists. A great number of those are cosmetologists. And we have reason to believe that either labor trafficking, sex trafficking, some form of human trafficking is going on, not in the legitimate businesses, but folks that are jumping in and saying they're legitimate and aren't. And these prevention liaisons are going to be able to go in, whereas our field inspectors, They'll see things, and they will bring that information back. Our investigations reveal things, and they bring that information back. And this team will have the bandwidth to also go in and conduct inspections.
Do those facilities, do they have to have their license in plain view, just like we do?
There are a lot of things that they're supposed to do that we are finding that may not be done. But it's because there wasn't an inspection component years ago. DSHS handles a plethora of health issues, and I think we had Zika during that time period. We've had Ebola. I mean, real deadly health issues. And so at that time, massage establishments were not being inspected regularly, if at all. So there are, yes, your licenses should be up and visible, but there are other signs that we become aware of that do exist in these different types of places that are kind of regularly seen in a certain type of establishment that's more illicit and not legitimate.
As far as cosmetology, you can see I don't use much cosmetology myself, but where does that tie in with the illicit part of it in cosmetology? Or are these people that are forced to work for nothing, basically?
There are concerns in cosmetology to possible labor trafficking.
And what's your definition of labor trafficking?
They are not being paid a wage. They do not know how they're to be paid, things like that. So,
Thank you.
yeah.
Hey, Mary, this is David. I assume y'all are tying in kind of with law enforcement at that point,
Definitely.
right?
Yes, yes. Every plan, I should say, interaction we have has to be planned. People get tired of me saying SOP, but there's a standard operating procedure, always a living document, but there's a process and a plan before we go out anywhere, and there's going to be communication with law enforcement, with NGOs, non-governmental organizations, those resources that we can get for those people. We don't want to go into somewhere as an inspector when we have not contacted law enforcement. Hey, they may have some surveillance going on already, and we don't want to interrupt with that. We want to work with, and we've met with quite a few of the different law enforcement agencies, different sections of the state, and so we want to coordinate to be just one big solution or a part of one big solution.
And I'll just add to that, this is Christina Kaiser, Deputy Executive Director, that the importance of interacting with law enforcement also is just for the safety of our folks out there on the ground. That's always uppermost in our minds.
Yes.
Thank you, Christina. Mary? Moving to agenda item G.
Hello there, board members. Alex Phipps again. I'm here to present item G. So this will be draft amendments to Rule 114.40 of the department's rules regarding the Orthotists and Prosthetists program. So the amendment is necessary to implement the requirements of House Bill 2059 from the 86th legislature, so that was this year. That bill created a new Chapter 116 of the Occupations Code requiring human trafficking prevention training for healthcare practitioners prior to the renewal of a license. So you'll notice that's healthcare practitioners, not orthotists and prosthetists. So this bill was not targeted at your program specifically. This is a broadly applicable bill, covers the entirety of Title III of the Occupations Code, which is a lot of different professions. Here at the agency, we had a bill implementation team that worked on this. They put together this language, and that will be what we're discussing here today. And I'll walk through the two changes to this rule just because it's very short. If you have any questions, of course, interrupt me and please let me know. The first change is in subsection A. This is a cleanup change just to remove a reference that should be pointing back to the definition section of this rule. Unfortunately, this section had a definition of licensee that was separate from 114.10. So what we've done is inserted the language, have the meaning assigned in section 114.10, and deleted the language there that provided a separate definition. So that's just for clarification and to avoid confusion. The more substantive change is in subsection C7. The language there is to require each licensee renewal on or after September 1st, 2020 to complete the human trafficking prevention training required under the Occupations Code, Chapter 116, and provide proof of completion as prescribed by the department. So that's the language that the bill implementation team here at TDLR put together for all of these health professions. So staff would recommend that you propose this rule as presented so that it can receive comments in the Texas Register. Happy to answer any questions that you have.
Is there any chance that the course won't be ready by then, or legally it simply has to be?
This agency does not control the preparation of that course. That
Right.
will be approved by HHSC. HHSC may also promulgate their own course. At least one will have to be free of charge. But again, all of the authorization and promulgation of those courses rests with HHSC and not with TDLR. So we are simply putting in rule what's already in statute. This requirement will already exist regardless of whether or not this rule is adopted. This is simply to make sure that our practitioners are aware of this requirement when they go to renew their license.
Okay, as long as I've got a course to take.
We certainly hope so, and of course, we will assist
that-
putting out the word if there is a course. As soon as HHSC updates their website, they do have a webpage about this. It should be available there, and my understanding is that at least one free course should be available shortly. But again, that's outside our purview. We can simply adopt the rules that we have in front of us.
Yeah, so if that were to happen, I guess this would be put on hold?
Again, this is a statutory requirement passed by the legislature, so this agency has no control over that, unfortunately.
Okay.
Basically, it is what it is.
Yeah,
That's what it is.
sorry. Obviously,
That's what it is.
we would love to have more control, but we do not.
I don't
Any
see
other
anything
comments
wrong.
on item G? If not, we'll proceed to item H.
Actually,
We
we
need
would
a-
recommend
Oh,
that
I'm
you
sorry.
have a
Yeah.
motion and a second
So
to
do I
propose this
hear a
rule.
recommendation?
Yeah, I
motion.
guess I make a recommendation to accept the language as presented.
Second?
Any discussion? Yeah. All in favor?
Aye.
Aye. All against? So moved.
Thank you, board members.
So now we proceed to item H.
So board members, now I'll discuss this item. Obviously, this dovetails with the previous agenda item and the rulemaking there. Our executive director requested that we bring to you the option of reviewing the requirement for this human trafficking course as a continuing education credit. Obviously, your existing rules do not contemplate that. So what we would recommend is that you possibly refer this to a work group, either an existing work group or a new work group that you may want to create here today, to consider first the question of whether or not that would be appropriate as a continuing education credit, and second, how that amendment would need to be prepared and brought back to this board for possible proposal in the future. So obviously that will be several different questions, and the work group will need to chew on a few different questions when they are working on this topic. So that option is here for you today under this agenda item. Happy to answer any questions you have about that.
So I have a question.
Sure.
So you mean this would have to be a change made on at the legislative level?
No, your rules currently, as they're drafted, do not contemplate using this human trafficking course as a continuing education credit.
So we could do it at the rule level?
You would need to amend your existing continuing education rule.
And so that led me to another thought, and that is, could we also provide continuing ed credit for the jurisprudence exam?
So that would be outside the scope of this agenda item, but you could discuss that as a possible future item later on the agenda.
Or that work group that is convened could discuss it?
Well, you would again need to put that as an item for a future meeting, but if you would like in the future to consider that at a different meeting, sure.
Okay.
Any thoughts from the board?
As far as a work group to
Yes.
consider this?
Yeah.
Mr. Chairman?
Yeah.
Christina Kaiser, Deputy
Mhm.
Executive Director. You probably know this already, but you already have a work group formed for education and examination questions. And their purpose, as written here, is to review and make recommendations regarding education and examination, continuing education requirements, and rules.
Mhm.
The members who were appointed were yourself, Mr. Mojica, Randy Duncan, and Kevin Matthews. So I don't know if you, since Mr. Matthews is no longer on this board, you could appoint a third person in his place if you wanted to. Otherwise, it would just be the two of you, whatever you prefer.
Yeah.
And we can't have 3 on that, can we?
You can have up to 3
In a work group.
in a work group.
That doesn't
You could
violate
actually-
open meetings?
No, because even though there may
They
be
have 9 total?
a place that's open,
No, 4 would be a quorum.
4 would be a quorum. 3 we can have. It's for the spots, not the actual individuals.
Yeah, so I think this ought to go to a work group.
Okay.
And do you want another person on your work group?
I don't think we need another person unless Randy thinks we need another person. Randy? Unless you think we need another person, do you think we need another person? No, okay.
And Chairman, you can go with 2 if you want. You can
Yeah.
go with, and the work group can also, you wanted to discuss another issue, as long as it's not in the open meeting, if the work group wants to take on discussing another issue, that is fine. I think you were concerned about continuing education.
Yeah, well,
Okay.
I was concerned about the exam process
Okay.
for the organization that we're using to administer our exam,
Okay.
because
And
they're changing their rules. Can I talk about that now? Is that okay, or do we
you
wait
want
for
to
future?
move that
to
to,
the-
now, that's going to be a work group.
Okay.
And that, since that is not on the agenda, we can't discuss that right now. But
Okay.
internally, staff can, I think I've heard wind of that, and I
Mhm.
have a long document that goes into different things, and the E&E work group can discuss that as a work group with staff, but not as an agenda item.
Okay.
And we can, and once you discuss it, we'll put that on the agenda,
Mhm.
whatever the finding was, and we'll discuss it in the open meeting.
Okay. So I guess right now, I've got one person saying, yes, we need to move item H to the existing work group. Does anyone else have an opinion on that?
I agree.
Okay. So do we need to make a motion on this, or do we just comment that we're
Actually-
just gonna move it to the work group to look into this?
Mr. Mojica,
Mhm.
because as presiding officer, you can make that call. We don't
Okay.
need a motion. You can assign those work groups and make the assignments to the work groups.
Okay.
That is your call.
Okay,
No
so I'm just
motion
gonna
needed.
make the assignment to the work group that I'm in, so.
Okay.
That Randy and I are in.
That's the
Okay.
So
E&E
we'll
work group.
look into that further.
Just to be clear, Mr. Mojica, the
Yep.
E&E work group is the one you'd like to assign it to?
Pardon?
The E&E
Yes, the E&E work
examination.
group is the one we want to assign it to, correct.
And if you would also like to assign that work group, the jurisprudence question, you can assign that work group, and we can, if that work group wants to look into that as well, and we can then agenda it for the next meeting to discuss.
So I can make that suggestion now to consider that.
You
Even
can.
though it's not on,
It's because you're just making you can appoint work groups and assign what they can work on,
Okay.
period, as
So-
presiding officer.
so we'll also look at the jurisprudence exam and whether that can be counted as continuing ed for the A&E.
And
or
then
E&E.
the recommendation is to discuss the findings of the work group, and that's on I.
Okay.
Discuss the findings from the work groups that were assigned today and the subjects assigned today.
Okay. So as a recommendation, so we're moving to item I, so we're through with
Mhm.
item H then, at
Mhm.
this particular point. Okay, so we're
Thank you,
moving-
board members.
Thank you very much. I appreciate it.
Mr. Chairman, if I may, I'd like to go back to another agenda item. I have one more question for Mary. Is that
You just have to
Yes.
give that okay.
Yes.
Okay. With regard to the labor trafficking issue we discussed earlier, with the other programs that are under the umbrella of TDLR, and I'm just going to mention a couple of them, not that, like I say, the record drivers, elevator service people, things like that. Are there, or do those other departments or other programs, do they have problems with labor trafficking also?
Honestly, Mr. Smith, not to my knowledge. We had,
Or any of the other programs? not
We,
just
we did,
specific
we
to the-
did actually have a case of labor trafficking that came up in our licensed dog and cat breeders program. And that, I think that trial happened in January, or is happening now. Or the Attorney General's office was handling that trial. It was a case of, it was convoluted, but a case of, I believe, foster parents who were labor trafficking their foster children. So that was kind of like an out-of-the-box thing that we didn't anticipate getting. So we do come across situations in other professions. I think we had one more in our combative sports that a fist boxer, one of the competitors, there was a labor trafficking situation with the promoter, and if I'm getting that wrong, I do apologize. But here and there, we do find that labor trafficking has occurred sometimes.
Thank you.
So moving on to item A, so recommendations for agenda items for the next board meeting. As it was already mentioned, we're going to put on the agenda that we're going to review the recommendations that are brought forth by the E&E work group regarding the human trafficking requirement of doing the continuing ed there. And then also looking into using the jurisprudence exam also as credit for continuing ed. So that will be on the, we would like for that to be on the agenda, as an agenda item. Now, the other item I need clarification on is in regards to the fact that the agents or the organization that we're using now to administer our exams for licensing our prosthetists and licensing our orthotists, they have now come up with a new exam they just administered that brought those two exams together instead of separating them. And I think we're going to, I'm thinking the same work group will have to review that also. I don't know if we need to, can I make that recommendation now that that group looked
Along with,
for-
yes.
Okay.
And is that going to also be the E&E work group?
Correct.
It's
Yeah.
going to be a busy work group.
All right.
Yeah.
So, yeah,
And bring that discussion from that meeting back to.
back to the, to the board meeting, so.
Can we
Anyone
bring-
else have recommendations for agenda items?
I have a few.
Okay.
You all were given a handout of some possibilities that I would like to look at as potential agenda items
Yes.
in the future. Before I start on that, I actually just came up with another one. And so I want to start with that one before I forget it, because it's not written down. CMS has made a change on the requirement of prescriptions for Medicare beneficiaries. So there is now a change on the federal level, I guess you would call it, by CMS that states when we have to have a prescription and what that prescription looks like. And that change went into effect on January 1st of 2020. And so now, we may not want to change anything about our rules, but now our rules about prescriptions is more stringent than CMS's rules about prescriptions. So I think we ought to have a work group just look at that CMS new rule and run it alongside ours and see if we want to do anything at all. So I'd like that to go to a work group. I don't remember the names of all our different work groups that we have.
Assuming Mary Winston TDLR standard of care, Ms. Mize, you, Mr. Duncan, Mr. Aarons are on that work group.
Okay, that sounds good.
If that so pleases our chair,
Yes.
then that work group is already up and running, and our staff, Heather, is nodding at me as manager of RPM for this division. So if that work group, scheduling of that work group can happen internally, getting another nod, reaching out, and so that can be discussed. We have another agenda item for our next meeting. So that'll be a report from that work group, from the standard of care work group.
Standard of care work group.
Okay. Would it be appropriate for me to send you the new wording by CMS, from CMS? The maze to get there.
Sorry, just so everyone can hear that is watching. Heather Muir, Section Manager, Regulatory Program Management. Steve Eaker will actually reach out to the team and schedule that meeting, and at that time, you can send him the relevant documentation, and then he'll get that all put together in a package for review before your meeting.
Okay. All right, so I will talk to, or send that to Steve when I hear from him. Okay, perfect. All right, so thank you. So these points that I have on this paper, some were addressed in today's meeting. And so maybe we don't need to send them, but I want to bring them up and we can decide whether they should go to a work group or not. The first one had to do with enforcement cases, and as I alluded to earlier in the meeting, what I would like to see is if we can change some of the information that is given to us as advisory boards members, and then perhaps on the grid that is published and put out there for the public as well. How much of what I wrote here can I actually talk about, Mary?
Well, actually, Ms. Mize, you have several items. As a matter of fact, there are 4 pages here that indicate things you want on at the next advisory board meeting. If you would like, you don't have to, you've been very thorough. For the record, she's given purpose, she's given discussion, purpose, and summary of issue. You don't have to put all of that in the record because we do have it here and we can put what we can on the agenda for the next meeting. On number 1, discussion enforcement cases. As you stated, you would like a possible enhanced reporting of opened enforcement cases, and you've given us examples of the information you'd like to see: types of complaint, short summary of complaint, resolution, when reached, final order or other, paid fine paid, cases taken to mediation or SOA, and days open. We will get enforcement to take a look at this, make sure we all have copies of it. It's going to go in to the record that we file. And we're going to work another work group here to get this on the agenda with actually substance. We need that enforcement work group to meet in between time. And we have, Mr. Matthews, who's no longer here, with Catherine Mize and Randy Duncan. This is another.
Why would all the work groups are away?
Yeah, you agreed to it. I remember.
Did he show up late
We're just
that day?
picking the
Mr.
work groups that have
Mojica
you
is-
in it.
So let's say term expires.
Mr. Mojica, okay, Mr. Smith is just like sitting there. So
I think we can put Mr. Smith on this work
Mojica
group.
can, and Ms. Mize isn't complaining about working on these work groups, and this is some of the things she's brought up.
So
But
Randy, are you complaining
No,
about being on the group?
no, I'm just observing. That's all.
if
Truth hurts.
Mr. Mojica would like
Yeah,
to
let's add.
change that work group, he can do so at this
change the
time,
work group. Well,
or the members. Ms. Mize wants to stay on this group, I'm thinking.
Yes.
Okay.
Yes, ma'am.
Ms. Mize
Okay.
would be on every work group if you let her.
Yes, sir.
There you go. And so, Mr. Matthews is no longer here. If you wanted to,
so the standard of care work group, who's on that one right now?
well, Standard of Care Work Group,
Yeah.
Ms. Mize, Mr. Duncan, and Mr. Aarons.
Okay. So like Randy said, he's on all 3 of these.
It's fine.
Yes, he is.
Okay. So we'll add, Mr. Smith, would you like to be added to the
Which work group?
enforcement work group?
Enforcement.
Yeah.
I feel the love. council's on that, Catherine?
Randy and you now.
Okay.
Okay.
And then back to the education group, since there's 2 people on there, Randy's on all 3, let's add, are you okay with being added to that group?
Which
Mr.
one?
Smith, the education?
Oh, no problem.
Okay. So that'll give us 3 members there, so Randy didn't have to work so hard.
So that'll put me with who?
Myself, Randy, and you for the education.
Catherine's not on that one?
No.
He won't let me.
The meetings will be short.
That's it. And there are how many work groups?
There are 4 current work groups. We have enforcement, licensing, education and examination, and standard of care.
Thank you.
So, Ms. Mize, Mary Winston again, the next discussion item you have is communication. Possible ways to improve communication between a potential licensee with TDLR once the application is received and under review. I'm not seeing this under a work group, but I do see this as something as part of kind of what we've been talking about today, and maybe it's it's licensing, but
It's licensing. Could it
it's
go under the
licensing.
licensing work group?
we have one, and you're not actually on that one. So
Can I get on it?
It's up to Mr. Mojica, who is on that work
Passionate
group.
about this one.
So for this work group, we have Mr. Mojica as well as David Aarons, and you can add someone else. Okay, Mr. Duncan. You're not on this one.
Randy?
You might get yourself
I
on there.
remember Randy being on this.
So we had Mr. Sterling Phillips on this one, who's no longer on the board. So,
So Catherine, would you like to be on the licensing
I
examination?
would.
think
okay,
you-
Catherine Mize is now on this one. And so for discussion item 2, communication, which is really licensing, communication, that's going to be another work group. The licensing work group needs to meet and with staff, and we have under there for staff, Ms. Dee Dee McEachern, who's listening. She's sending me IMs, so she kind of has notice on something else. Thank you, Dee Dee. And we have Leonard here from licensing as well to know about that. So for the 3rd item, web page information review. We kind of talked about this offline about what we are working on internally and just doing a page-by-page assessment of the website and so forth. Thank you, Josh, for all that you're doing. We've had some turnover in this division as well and for these positions, but Josh has been doing this steadily, and we will need to, that's an internal thing that we need to work on before Ms. Mize, for the record, wants the user, it to be, I think, Mr. Aarons, you call it a focus group, but what we see on the user end versus what we see from our end as the person or the agency that's putting out that webpage and how that works together. So can we table this while I can discuss this with our web team? And this can be a possible something for our next meeting, but I would like to work with our web team before we move forward to getting the user perspective. Let's make sure we have touched this page, because I don't know that Josh has gotten to work on this page yet on OMP. And then I can give you kind of like a notice or an update before where we are and where we can move from. And so I guess we can put that on. That'll just be on me.
Okay, all
So,
right.
yeah.
Yeah, so, I'm sure what he's doing is painstakingly painful, but he doesn't necessarily know the questions that
Oh, yeah,
us as
yeah.
professionals are trying to get answered
Yes.
on our webpage. So I'm trying to make it more the webpage more intuitive to the professional using it for
I
information.
just want to find out from him
Okay.
where he is, because this is kind of, as he works on all these projects and goes painstakingly page to page, I don't want to say, hey, stop what you're doing. And
Right,
I
right.
want to know if this is a good time or if I can give you a good time so we can meet and do this. And I just don't know if we're there yet. So
Perfect.
I just don't want to abuse Josh. The number 3, we have, I'll read this into the, we've discussed this one, and there's, well, anyway, here's what it says. Possible TDLR engagement with HHSC to compel a Texas Medicaid MCO to resolve irregular care payment practices to Texas licensed O&P providers on behalf of Texas Medicaid children. This is a wonderful altruistic request, and you're requesting staff to engage, of TDLR to engage with HHSC. And then, I don't know our authority to compel anybody to do anything with the federal government. I think it's 0. But I've put this out here, and you wanted it kind of read out publicly. And as far as staff has been looking into this. We know currently we don't have any authority to move on it as TDLR. We've gotten the issue publicly stated, and we can look further into it, but we do know that as TDLR, we don't have the authority to compel Texas Medicaid MCO. But I know you're concerned with HHSC, and I don't know if you've reached out to them as to what they can do or what have you. But duly noted, because your purpose is you want services to children not to be withheld.
Right.
Okay.
And that is what is happening. In certain circumstances, kids are simply not getting the braces that they need to get because the provider knows they're not going to get paid.
Okay.
By this one particular MCO, and when they file complaints and go through appeals, it's going absolutely nowhere, and we don't know, they don't know how to get it resolved.
And you have included some information that has gone to HHSC.
Yes.
So we appreciate your input and your reason for bringing this up. We realize our limitations here at TDLR, but we appreciate you bringing up that issue. I think we've covered discussion or recommendations for agenda items. We've assigned a whole lot of work for you guys to do, as well as some of our staff to facilitate these meetings. And our staff will reach out. A lot of these are done over the phone conferences. I'm getting nodding from Leonard in the back. And so currently we have work groups that are meeting. Enforcement work group. We'll have someone from enforcement reach out and get that schedule. And that is Ms. Mize, Mr. Duncan, Mr. Smith. We have licensing work group with Mr. Mojica, Mr. Ahrens, and Ms. Mize. You got yourself on that one, Ms. Mize. That's the one you weren't on. And, oh, wait, E&E is Mr. Mojica, Mr. Duncan, Mr. Smith, and Standard of Care, Ms. Mize, Mr. Duncan, and Mr. Ahrens. So
Yes,
we
there's one
we
more.
have quite a lot of work to do, which is good, We appreciate y'all and making sure there's a good, clear picture on as much as we can do as an agency.
Mary? As Ray Smith, if I may, with
Yes.
regard to the issue that Ms. Mize is bringing up with an MCO, I would think that would be regulated by TDI as well. And I would think that TDLR would carry a pretty big stick, and they could make a referral to TDI. Is that possible?
I don't think so, but I will look into it. I don't know how
Can I
big our
comment?
stick is outside of TDLR.
Can I
Yes.
comment to that? I filed a complaint regarding this issue with TDI, formally.
She's already gotten that ball rolling.
And I got a formal answer, and that is that they have no jurisdiction.
What do they do then?
They have jurisdiction over 16% of Texans insured. That's why I found that earlier information. So the complaint that I filed to HHSC went to if you look at the email address, and I put my complaint in here so you can see it. You can see the email address that it was directed to, and it ends in US. So it goes to state.texas.gov.us or
So-
some version thereof.
So what you're saying is TDI, which licenses any insurance organization working within the state, has no jurisdiction over an MCO providing care.
It has no jurisdiction over Medicaid.
We have
Medicaid.
now gotten way beyond what, I mean, the conversation is fine, but we just have no authority, as you can see. And we can talk offline because it's really not
Okay.
TDLR business, so to speak. We'll do what we can do, but Ms. Mize, not as a board member, but as Catherine Mize has filed a complaint, professional.
Correct.
And so they're aware of the problem, and unfortunately, that's not under our purview. And Mr. Mojica, we are at the discussion of date, time, and location of the next board meeting. Of
Let me
course, location is here.
I need to take one step back real quick.
Okay.
Because I had discussed the issue with the exams and how they're changing.
Mhm.
And I basically assigned it to the education group, and I think we should just assign that to the licensing examination group instead.
The licensing work group?
Yeah, the licensing work group instead.
Okay.
So,
Okay, we can
That
start
was
in
the
the
only thing.
licensing work group.
yeah.
And if it needs to move, then
Yeah.
we can
So
move
I'm just
that.
moving that over to make
Yes.
sure that is clear.
Okay.
And now we're moving to the item J for discussion of date, time, and location of next board meeting.
Yes, we'll be here, but we can also, we don't have any dates that
Okay.
we have in mind at the time. We can poll the board and individually and make sure what's good for you guys, but we just want to make sure we don't anticipate a lot of comment from the rule we discussed, but we have a lot of work to do within our work groups, so we want to give you time to actually meet a couple of times, once at least, and come up with a report that you want to bring back. And so, if it would be okay, we will poll the board later to set that date and time.
I'm comfortable with that.
Okay.
And do I have a motion to adjourn?
To adjourn.
Do I hear a second?
David Arns, I second.
All in favor?
Aye.
All against? So moved. Thank you very much.
Let's stay